Welcome to the show. I'm Tosh Taylor.
And I'm Jenna Morton, and we are thrilled to have a return guest with us today, someone that we love having on the show, and we realized it's been way too long, and this is a perfect month to have her back. Carolynn Dube is back with us. She is the Executive Director of Fertility Matters Canada. Welcome back to the show, Carolynn.
Thank you for having me. I'm thrilled to be here.
I am still just in awe of the work your organization does and the fact that we are lucky enough to have you here in the Maritimes doing this work. But for those people who don't know what you do and what your organization is about, give us the quick reminder.
So Fertility Matters Canada is a national charity, and we're the only organization in Canada that does the type of work that we do. So we provide support, education, we do public awareness and advocacy work on behalf of the 1 in 6 Canadians who need access to fertility and family building care.
Amazing. So like Jenna said, we're really lucky to have you here in the Maritimes. And there's a really important thing that goes behind that. Something that I've learned with your association and really just anybody that's dealing with infertility across Canada. In the Maritimes, we're one of the places that has the hardest access, correct? Or the least access, should I say?
Yeah, we do actually. So 1 in 6 Canadian adults will experience infertility or need access to this care. In the 4 Atlantic provinces, we only have 2 fertility clinics.
Wow.
And so those 2 fertility clinics serve the entire population of people. And what that creates, there's one here, right here in Moncton, and one in Halifax. So if you're more local to those areas, that's easier. But if you're someone in Newfoundland and Labrador, you have to get on an airplane to get access to a fertility specialist, and that creates real challenges and barriers to people who need access to the care.
It's funny, in our family, we were just having a discussion, last night around the dinner table about this idea that, as Canadians, we're so proud of our free healthcare and our access to healthcare, and yet there are so many spots along that journey that really are not barrier-free yet, are not accessible. Talk a little bit more about, across the country, what we are supposed to be able to access and where we're at with that.
Sure. So we live in Canada. We have universal health care here. Fertility or infertility don't fall under the protections of Canada's Health Care Act, which means since health care is delivered provincially, it's up to each province to determine if they want to provide a publicly funded fertility program for their residents. And so what that's created is a real patchwork of support and access points and public funding and policy for people in the different provinces. So it's not universal, and it's certainly not equitable. When I started with this organization 10 years ago, we had 3 provinces with funding. We just celebrated in March the fact that 9 of the 10 provinces now have public funding in their provinces. And 2 of the provinces, 2 of those 9 are, actually 3 of those 9 are now improving the care that they have promised. New Brunswick is actually one of them. In fact, New Brunswick's fertility program is one of the earliest to exist in this country. So it's nice to see that now we're improving that access to care with an investment of additional dollars. So when we look at how these public funded programs work, in provinces like Ontario and Quebec, they have what's called a free round of IVF. So that means that when you go to a fertility clinic, the cost of your IVF, the clinical, the medical piece, the ultrasounds, the surgery, blood work, all of those types of things, that's covered. You don't have to pay the clinic for that service. In other parts of the country, so New Brunswick, Nova Scotia, Manitoba, those provinces have refundable programs in place. So the patient is responsible to pay upfront and out of pocket for those services. They submit receipts and they get a portion of those costs reimbursed to them.
Now, what about provinces like PEI and Newfoundland and Labrador that have to travel? Do they get any of that travel cost covered or anything like that in their provinces?
No, so right now, PEI has a program. It's they get a reimbursement of about $5,000 to $10,000. It's based on annual income of the household, which is challenging, And just for context for listeners and for yourselves, on average, a round of IVF in Canada is about $20,000. And that's the clinical, that medical piece. And it also includes drugs. And drugs can be up to half of that cost, $10,000 usually. So we have about 50% of employers in Canada who are part of this sort of landscape of helping to support and reduce the access, the barrier access issue by providing fertility benefits to their employers. So if you're someone who's fortunate enough to have an employer who has drug coverage, for example, that cost can be significantly reduced. So in places like PEI and Newfoundland, PEI, arguably your travel and accommodations could be, reimbursed for, but the challenge is that when you're only getting $5,000 back and your bill was $20,000, it's really a drop in the bucket. And most people need to have more than one treatment cycle in order to take home that baby.
Mm-hmm.
It's amazing to think of how far we have come in just those 10 years that you've been involved, that we've been talking about this, and yet how much further we have to go for this to really be something that is equitable across the country. Can you talk a little bit about kind of the mood now when you're dealing with provincial governments, federal governments, agencies, employers? What is that kind of vibe among people now to talk about the issue?
So it's certainly on an upswing. That is really clear. And where we really saw that happen was this fall. This fall we had 4 provincial elections happening. And in those provincial elections, certain parties within each of those campaigns had fertility coverage as in their campaign platforms.
Wow.
And so that's pretty significant. So the other really interesting thing is that this is not a one-party only issue. And no matter if we're having conversations with the federal government, the opposition leaders and their teams at the federal level, or provincial and territorial governments, it is an issue that we have unequivocal support from across the board. They understand that this is something that isn't going away. It's really an epidemic when you think 1 in 6 residents in each province. And the other thing that I think is happening is that they're looking at it not only from a healthcare perspective, the significant mental health aspect of this, they're also looking at it from an economic perspective. Because Canada has just come through our lowest birth rate for the 2nd year in a row in our history. And what that means is we're not producing enough Canadians, or we're not producing enough people in this country to replace our population. And the economic health of the country is intricately connected to the fertility rate of the country. And so if we're not replacing our population, looking 30 years from now, who's paying pensions, and who are the nurses and the hospital staff taking care of us when we need it? So it's multi-layered, and it's not something we're just seeing in Canada, but it's an issue that's happening across the globe, and we're seeing other countries take different measures to see how they can help people in their countries have more babies. Of course, IVF is not it's not the Band-Aid that will fix it all, but it's certainly one piece of the puzzle that can help us support Canadians to have more babies.
So when we're talking about provinces that have specific coverage, and we were focusing on IVF there, is there coverage for other forms? So say egg collection or anything like that, donors, surrogacy?
Yeah, so there's a couple of things. So IVF is a procedure where you grow a bunch of eggs, stimulate a bunch of eggs in the ovaries, you go in, surgically remove them, and you physically, then you have a sperm sample and you create embryos in a dish. And then when those embryos are ready, you transfer an embryo back to the uterus and you hope for a pregnancy and then a live birth. It's not the only fertility treatment that people need. Some people will do intrauterine insemination, for example. That's where they have a sperm sample and they take it's not a syringe,
Turkey baster?
A turkey baster.
It is what they would have called the turkey baster method.
Yeah.
Exactly. That's right.
Not the medical term,
No.
but you get the idea.
Yes, a catheter. That's the term I was looking for. And the sperm is put back into the uterus in the hopes of, and usually there's some medication involved. It's much less invasive, but it's not as the success rate is not as high as IVF, and there's a much higher incidence of higher multiples. So twins are higher order multiples, which is not the healthiest option, as you would know.
As we both experience
That's
with.
right.
Yeah.
For mom, and of course the health outcomes of the baby. So, so in some provinces, those things are covered. There's also something called fertility preservation, and that's where a woman or someone with eggs and ovaries wants to preserve their fertility for a multitude of reasons. Maybe a young cancer patient. It may be a young woman who is going on to postdoc schooling and doesn't have a partner, isn't sure if she wants kids, but she wants to preserve her fertility, put those eggs, cryopreserve them in case she wants to have children in the future, and she's not sure when that may be. That is an option, but it's not an option in all provinces. Ontario covers that service.
Okay.
And you could submit receipts in some of those other provinces for that service. And not all provinces with those refundable programs also cover that service.
Right.
So you really have to understand the program in your province to understand what the coverage is.
When it comes to figuring out all those options, scenarios, what's covered, what's not, what role does your organization play for the person who finds themselves in a position of wondering, what their fertility journey is going to look like?
So our main source of support for patients, we have an online support community, and so people can join. It's free. They can ask questions. They can directly connect with us. Most of our services are actually provided through social media. It's where we connect with our community the most. And so not only can they find that information sort of through our website, they may be in one of our support groups where they can ask those types of questions, or they can connect directly with us, and we can help them navigate what makes sense for them and their particular situation. We aren't doctors and we're not fertility experts, but we work with the majority of fertility clinics and a lot of fertility experts across the country. So if we can't help guide them down the path that they need, then we certainly have the connections to make a direct path for them to someone who can help navigate that for them.
And I think that must be so powerful and so different a landscape than it was 10, 15, even 5 years ago, I would imagine, has changed a lot.
Yeah, and the medicine is still so early in its, it's really in its infancy, for lack of a better term. The first IVF baby born isn't 50 yet.
Really?
Yeah, so when you think of the grand scheme of the medicine for heart, diabetes, and cancer even, like those have been studied and researched for so many years, and the science that we have is so new. And now with technology, the online communities, more and more people are sharing publicly, has created sort of an online community. People feel like, oh, someone else is going through that. It makes you feel less alone. More and more celebrities are starting to talk about their own experiences. So it's certainly, over the last 5 years, there's been a significant shift in not only public policy change and government change, but the number of people speaking about it, the number of employees starting to implement fertility benefits for employees, employers implementing for employees. It's certainly changing.
I wondered about that the other day, actually, because we just came past April Fool's Day, which I know in the past, your organization has had a lot of campaigning around reminding people, pregnancy is not a joke, don't make April Fool's jokes around the topic. And I had this moment of wondering, like, I don't feel like I see that anymore. And then I was like, is that because people are more aware, or is it a reflection that I'm older and I just I'm not associated with people who would make
Those
who are in
jokes.
the age category to make those
right.
kind of jokes right now.
Right. It's probably a bit of both. I mean, we sort of do a bit of a public awareness campaign every late March. But in fact, what I'm seeing, and it's interesting because I also noticed it this week, that before we would have even said anything on social, other people And people that weren't even part of sort of the fertility community necessarily were starting to share. And of course, it's not to shame people who are doing it. I get it. April Fools is fun. But the challenge is that for people who are in this fertility journey, like when you're diagnosed with infertility, it has the same impact on your mental health as being diagnosed with a more significant health disease, like heart disease or cancer. We don't treat it the same. And when 1 in 6 people in your circle are likely being impacted, sharing something like that is likely going to be a trigger or an activation for someone in your circle. So even if you don't know, someone's like, even if someone in your circle isn't telling you that this is what they're experiencing, you certainly know someone without knowing that that's what they're going through. And so it's more of a public awareness, like, especially to your point, if you're in that age group of people, friends, family, who are that age, we ask them to sort of, just kind of be aware of it.
And that's the thing, like we were talking about how much we've progressed in, say, the last 10 years talking about this, but there are still so many of us that were raised, it's like, you don't talk money, you don't talk politics, you don't talk about making babies, so like it's not discussed. Like I can definitely tell you, when we first started trying to have our oldest daughter, nobody knew how long we tried before we got her. And it wasn't because we were embarrassed, it just wasn't something you talked about, right? So I can see that, of course, you know somebody who's either been through it or currently going through it. But that does make me wonder about the 1 in 6 number. Is it a new number just because we're starting to learn more about it? Or is it because people are actually starting to, like, instead of I guess I just can't have kids, people are actually starting to investigate why they can't have kids?
Yeah, and I think it's multi-layered. So yes, more people are now understanding that, my eldest is 11. And so my fertility journey started 12 and a half years ago. And even then, and I'm someone who's I've got a great network of girlfriends and family, and we're very close. But we got that diagnosis, I didn't tell a soul. 4 months. And that is Tosh, your experience is not unlike that for so many people. So I would say the conversation is becoming normalized, but when our parents, if we have parents who have friends who didn't have kids, it's likely that they couldn't, and nobody knew. So yes, to your point, there's some of that. Infertility is on the rise, like we're seeing, and it's multifactorial, environmental, stressors. The other thing is that families are starting later.
Yes.
So people are having their babies, I don't know, on average 30, 31 now in Canada, I think is the average age. And so because we're waiting, society's telling people, wait longer. Get an education, maybe do some traveling, meet a partner, get married or don't get married, buy a house, and then when you're ready, have a child. And it's not fair because it really does put more pressure on the woman, because I was going to say, not to quote Pierre Polyev, but your biological clock. He recently mentioned that, and
Numerous times, yes.
Yeah. But that biological clock really does start ticking.
It's biological. That is a fact. It biologically does have an end date.
Yeah.
Exactly. And so the challenge becomes that your ability to conceive does sort of fall off after age 35. And so if we're not starting to have our babies until 32, or trying to conceive till around that age, your fertility is declining. And also we're finding out that you had a long-standing issue later. And so by the time you discover you have the issue and then treat the issue or figure out what the issue is, again, more time has passed. And so it's a bit complicated like that. But to your point, there also are instances that infertility is just on the rise. 50% of the time, infertility is a male factor. The person with the sperm, it's their issue. And so that becomes something that we need to kind of consider.
And am I right to say that I think we don't talk about that as much yet? Right?
Male factor?
Yes.
Yeah. And I agree with that. And I think when I even look at our own community, I mean, we've got a community online of 32,000 people. Like, it's big. And our stats are something like 97% of our followers are women. And so it's just that men and women connect fertility differently. Women, it's sort of this innate need. It's so personal. It's like, my body is sort of failing me to be able to produce a child. Men, quite often, it can be associated with their sort of masculinity and their sexuality, when that's, not the case. It's literally, there's an issue physiologically, and so men aren't talking about it as much. It's really embarrassing. We're like, to your point, politics, religion, and sex. We're not talking about these things, and so it's really hard for men. Women are more open about it now, and they're also collecting information online differently than men do. So we need to do more information, more sharing. More men need to be sharing their experiences, and that's part of the work that we try to do, to connect men and the male stories to the community, so that more men can understand that, oh, okay, this could be my issue too. That's something we hear a lot from our community, that women are saying, we're not conceiving, my husband doesn't think it's his issue, so I'm the one with the burden of going to the clinic. And when you get to the clinic, the doctor will test both partners. It's just non-negotiable. That's just what happens. So we just need to do more education and have more stories being told.
I remember your first time ever on our show, like way back in the day when we were still filming in my basement, and you were telling us your story. Probably was right after the twins were born, I'd say. But we had asked you how Brian, your husband, dealt with it. And you thanked us for asking that, because nobody asks how the male deals with the situation. It's always, how are you doing? Yeah.
That's really good. That's a very good memory. It's true, and Brian talks to me a lot about that now, because we actually were diagnosed with male factor infertility. So the issue was with my husband, and I didn't have any issue that a doctor could find. And so we had to do IVF. That was our only option. And I was the one that had to do the surgeries and the medications and so that's typically because the woman, again, bears the brunt of the procedures. Women are concerned, or people are more concerned, or see the woman as the person that's going through it. But there isn't a whole other partner that's involved here. And I even got caught in that trap. Did I ever ask my husband how he was doing? No, because I was also dealing with it myself. So it was a really challenging time, and we actually see a lot more couples break up because of their infertility. They have a higher incidence of marriages breaking up or relationships breaking up because of the stress and the strain it causes on a relationship.
I believe it. Yeah.
It's an emotional spot to leave it.
Yes,
Unfortunately, we are running out of time. So before we wrap things up, we really want you to let people know how they can connect with the organization, whether they feel like they need your support or they want to be an ally. How do they find you?
Yeah, so we can be found across all social channels. Fertility Matters Canada, or Fertility_Canada on Instagram. That's our biggest community. You can also find information at fertilitymatters.ca. And April 20th to 26th is Canadian Fertility Awareness Week 2025. We've got a really special event happening across the country on April 24th. That's Thursday night. We're lighting over 50 monuments across the country green. And so here in downtown Moncton, we'll have just outside the Avenir Centre will be lit green. So we'll be inviting people to come out, and if you are someone who's been struggling, come and see us there.
She also has an excellent podcast that you can find through their website.
No bias over here.
No bias. They have a really good editor.
Yeah.
They do.
Thank you so much for coming in and chatting with us, Carolynn.
Thanks for having me.
And thank you all for watching and listening. And we probably actually won't be back next week. You might have some reruns for the next little bit, but we will return, and we appreciate you listening and sticking around.